Hello everyone. So the next topic which I will be discussing is about the disorders of the skeletal system. So first we will discuss what is skeletal system. Then we will be discussing the various disorders that are related to the skeletal system. So let's start with the introduction. That the skeletal muscle is the basic framework of our body. The entire body are built around the hard framework of the skeleton. It is the combination of all the bones and the tissues that is associated with the cartilage and the joints. So almost all the rigid or solid parts of the body are the main components of the skeletal system. So if I talk about the human body, so the human body, it is well-oiled machine and it has numerous components and functions that work in conjugation with each other, and to keep this machine in a good operating condition, so one of these parts is the muscular and the skeletal system. So the muscular skeletal system consists of various parts, and what are these? These are muscles, these are ligaments, joints, tendons, connective tissues and bones. So these are all the parts of the mucoskeletal system. Now, what is a disorder of the skeletal system? So how can we define the disorder? So if I define the disorder in layman terms, it is an order or an abnormality. So disorder is something that is abnormal in the body, that is causing something, some problem in our body, that has some symptoms in our body. So this disorder can afflict any machine or human body. Human body, like most machines, it undergo wear and tear over time because of the age or misuse. So this wear and tear will lead to the disorder. So the muscular and the skeletal system is also subject to diseases, and this affects the human body adversely. Now, there are 6 disorders which are being displayed here. So we will be discussing each of these disorders in detail. So let's start with the first disorder, that is the Gravis disorder. So what is it? It is an abnormal condition or abnormal weakening and rapid fatigue of certain muscles. It is due to the breakdown in communication between the nerve and muscle. So why this happened? Because of some breakdown between the nerves and the muscle. So here you can see this is a muscle and this is a nerve. So there you can see there is a gap which has been there. So that is being blocked. So in normal conditions there is a sodium ion which is present, but in the other condition in which there is a grievous condition, there is the antibodies that are present and it gets blocked. Now what are the features of this disease? So there is a dropping of eyelids, weakness in the arm legs, change in the voice, and there will be a swallowing difficulty. So these are some of the symptoms of this Gravis disease. So the next disease is the muscular dystrophy. What is it? It is mostly hereditary. So it can be said that this disease is genetic. It causes progressive weakness and degeneration of skeletal muscles, which controls the movement. So now there are 3 types of muscular dystrophy which is being represented here. So first is DMD, which is the most common type. And when it happens, it begins at the age of 2 and 3. It affects the lower limb first, and then it impacts the heart and the respiratory muscles later on. Next is the Becker, in which it is also a type of muscular dystrophy, and this occurs at the age of 5 and 15. It has a slower progression than the other type of the muscular dystrophy, that is the DMD. What does it? The part which is being affected in this is the hips and the pelvic area first. and then it will cause the muscular weakness in the heart for the most. So these pictures are representing that how this dystrophy looks like. So this lady is sitting on a wheelchair. Why? Because this type of dystrophy, it affects the pelvic area first, then the hips first. In this, person the person is standing, but they have a the part which has been affected is the lower limb part, so they cannot walk properly. The limb riddle, which is over the 30 forms. It consists of 30 forms. It starts in either adulthood or in the childhood. What it does it creates the muscle weakness and atrophy in hips and shoulders. LGMD's progression is dependent on the age of the onset, so it depends on the age. Next disorder of the skeletal muscle is the tetany, which is caused due to low blood calcium, and it is characterized by rapid or wild spasms. It is being characterized by wild spasms. Now, there are two conditions which has been depicted here, that is severe tetany and the non-severe. What are the symptoms in the non-severe? There is abdominal pain, there is a chronic diarrhea, there will be muscle pain, there is tingling in hands or feet, then there is a twitching of fingers. This is the symptoms of the non-severe one. And if I talk about the severe one, then there is a loss of muscle coordination, there is a loss and change in the vision. The person can get the paralysis also. There is a slurred speech. Then there is a sudden difficulty with memory, thinking, talking, writing or reading, and sudden weakness or numbness on the one side. So this is the severe condition in the tatany. Next I will talk about is the arthritis. So it is the inflammation of one of or more joints, and it leads to limited movement of joints and the pain. It is one of the common diseases which is found in almost all the groups and the gender or sexes. And here I will be discussing about is the osteoarthritis. So osteoarthritis, it is the most common type of arthritis which is caused by the wear and tear or damages in the joint cartilage. So as you can see, this is a normal condition, and in this is the osteoarthritis. So there is a wear and tear of or damages in the joint cartilage surrounding the bone, and it results in the reduced friction among the bones. It causes pain and burning sensation at the joint. So it will cause the pain and burning sensation. And burning sensation at the joint. So it can be prevented by taking a balanced diet, maintaining the healthy weight, staying active, and by avoiding injuries and repetitive actions. So this type of osteoarthritis is seen mostly in the older women and other individuals with the prior joint trauma, obesity, and sedentary lifestyle. So this was about the osteoarthritis, which is a type of arthritis. Next is osteoporosis. So it is the chance of contracting this disease increases with the age, results in reduced bone mass and fragile bones, thus increasing chances of fracture. So there are low levels of estrogen which are common cause. So the low level of estrogen, it is a common cause. So as you can see here, in the healthy bones, there is a normal vertebrate, so everything is normal here. There is a normal bone structure and there is a femur. But in case of osteoporotic bones, this is how it looks like. So bones with osteoporosis, there is a hip fracture. In the femur, there is a fracture. So in this disease, there is an increased chances of fracture which has been there. The bones, they become fragile, and the most common complaint is of the fracture. So this was about the osteoporosis. The next is about the cord. So it is, this too is the inflammation of the joint. So it is also the inflammation of the joints, but due to an accumulation of uric acid crystals. So in this there is a high level of uric acid which is being accumulated, and it will leads to the inflammation in the joint. So as you can see here, there are stages which are being represented here. So first stage, in which there is a high level of uric acid level, and it is building up in the blood and starting to form crystals around the joint. So they start to form the crystal around the joints. Acute got, so these symptoms start to occur and causing a painful attack. In stage 3, there is a period of remission between the attacks. And the chronic one, in which the pain is frequent and trophy form in the joint. So this is the inflammation of the joint. So this was the last disorder. These are some of the references. Thank you.